Advocacy in Healthcare, featuring Matthew.
My name is Matthew Eubank. I'm a registered nurse, and I have been a resident of Lexington, Kentucky all of my life. Apart from the times that I've lived in Lexington, I've been active Guard, Reserve, and deployed as a veteran. So I am a proud serving member of the military and have been for a very long time. I as well teach with the College of Nursing, and as well I still serve with the Kentucky National Guard. I have had a large amount of experience and a large amount of time with patients who are seeking how to return back to work. It's always brought up as the forefront. I need to get back to work. I need to get back to my community. I need to get back to my family. And it's really interesting to see how much that mindset is for our folks here in Kentucky. As an advocate, I'm going to look at a patient and advocate for them to return to work as soon as possible, but also as responsible as possible. But also we see that strain from the side of the employer. And we see the strain that patients have. They're really trying to keep up with all of the things that they have and their responsibilities. And getting you back to work responsibly within a given amount of time that's really best for you as the patient. So when I have a patient that is looking at need for those resources, and we've looked through the electronic medical record, as a nurse, I'm going to start asking you questions. Those questions are going to be screening questions that assist me in actualizing that you have a need. Once we've actualized that need, the wonderful thing is the electronic medical record helps me by printing out something with your discharge, because no one wants to be sick, no one wants to be injured, but when those things come, as they most likely will come for all of us at some point in our life, it's really wonderful if you have a large institution that you're coming to, that you can look around and just ask, is there anyone that can help me? And I promise you, as a nurse, if you ask that question, we will find any and every resource to help you with your healthcare. When I've had that patient in our clinic that had those really difficult disease processes, and they've told me that they're a burden, I'm your strongest advocate. You're not a burden. You need assistance. You need help. I've seen a lot of soldiers that are injured and a lot of our Kentuckians. And through my continuum of care with the military service, and then through the VA Medical Center, University of Kentucky, and other entities, I see that our veteran population really is a special population. Some of them do not want to use the federal resources, and so when it comes to state resources or local resources, you've earned those resources. So you're not taking from the community, you're not taking anything you didn't earn. In fact, you're actually utilizing everything that you have access to and that you should access. And then if you're utilizing that in a way to get you back to work and get you retained within the community, I think that meets all the goals with our veterans. There's tons of resources through Retain to get you where you want to be. If you get injured or you have a disease, I'm going to encourage you, utilize your resources within big institutions and small institutions, your local community. They're part of your benefits of being part of the Commonwealth. And as a Commonwealth, we all benefit if we can get you more responsibly back to work as soon as possible and or retain you within the workforce. That's going to increase your self-worth. That's going to increase your ability to provide for yourself, for your family, for your community, for your loved ones. Please ask your nurses. They will be more than happy to help you out with that.
Retain Kentucky is funded by the U.S. Department of Labor and the Social Security Administration under a grant award of $21,600,000 to the Kentucky Office of Employment and Training that will be incrementally provided. 100% of grant funding is from U.S. federal funds. This product does not necessarily reflect the views or policies of the U.S. Department of Labor or the Social Security Administration, nor does mention of trade names, commercial products, or organizations imply endorsement by the U.S. government. Please visit us at stayatworkky.org